Good afternoon, Sarah. Today we're going to discuss some important warning signs that could indicate the presence of glaucoma, a serious eye condition that can lead to vision loss if not treated properly.
Hi, Dr. Mike. I've heard of glaucoma, but I'm not entirely clear on what the warning signs are or why they're so crucial to recognize early. Can you explain more about this?
Absolutely, Sarah. One of the most critical warning signs of glaucoma is increased eye pressure, known as intraocular pressure or IOP. Under normal conditions, your eye continually makes a clear fluid that fills the inside of the eye. To maintain a healthy level of pressure, your eye also must drain this fluid. In glaucoma, this fluid doesn't drain as well as it should, kind of like a clogged drain. This leads to an increase in the internal eye pressure, which can damage the optic nerve.
How would someone know if their eye pressure is too high? Does it cause any particular sensations or symptoms?
That's a great question. Increased eye pressure itself usually doesn't cause any symptoms, which is why glaucoma is often called the silent thief of sight. It's typically not something you can feel or notice on your own. Regular eye exams are critical because they allow professionals to measure your eye pressure using a tool called a tonometer.
Interesting. So, if you can't feel it, how does this increased pressure affect the eye or vision?
If the pressure inside the eye remains high for a long time, it can start to damage the optic nerve, which is responsible for transmitting visual information from your eye to your brain. This damage can lead to vision loss, starting with peripheral vision. It's like losing pieces of your vision puzzle, and without treatment, this can progress to a significant loss where you only have central vision left, or in severe cases, it can lead to blindness.
That sounds serious. What can be done to manage or treat this condition?
Yes, it's very serious, but manageable with early detection. Treatments may include prescription eye drops, laser treatments, or surgery to lower the eye pressure and prevent damage to the optic nerve. Regular checkups are crucial to adjust treatment as needed and monitor the condition.
Thank you, Dr. Mike. That makes it clear why we shouldn't ignore increased eye pressure as a warning sign of glaucoma.
Moving on to our next critical warning sign of glaucoma, loss of peripheral vision, or what we sometimes call tunnel vision. This is often one of the first noticeable symptoms of the condition.
Could you explain a bit more about what peripheral vision loss looks like?
Certainly, Sarah. Imagine your vision as a wide-angle camera lens that captures everything around you in a wide, panoramic view. Peripheral vision loss means that the edges of this camera lens start to fade into darkness, narrowing your field of vision. It's like looking through a narrow tube where you can only see what's directly in front of you, but miss things on the sides.
That sounds quite limiting. How do people typically realize this is happening to them?
It can be subtle at first, which makes it tricky. Some people might not notice anything until significant vision is lost. Others may bump into objects more often or struggle with activities that require a wide field of view, like driving, walking in crowded places, or playing sports. This is why regular eye exams are so important. An eye care professional can perform specific tests to evaluate the entire visual field.
Are there any particular examples that help illustrate how serious this can be?
Absolutely. For instance, consider someone who loves to play sports like basketball. As their peripheral vision diminishes, they might miss passes thrown to them from the side or not see opponents approaching from their sides, which can significantly impact their ability to play.
That definitely puts things into perspective. Once someone starts losing peripheral vision, what can be done to help them?
The treatment largely focuses on stopping further damage because, unfortunately, the vision already lost usually cannot be restored. Managing eye pressure, as we discussed earlier, is crucial. For those already experiencing significant vision loss, we work on strategies to maximize their remaining vision and improve their quality of life. This might include using vision aids and making adjustments to their home and work environments to ensure they are safe and more navigable.
It sounds like early detection and treatment really are key to managing glaucoma effectively.
Exactly, Sarah. Catching these signs early on gives us the best chance to prevent progression and preserve as much vision as possible. Regular, comprehensive eye exams are the best defense against glaucoma and its life-changing effects. The third critical sign of glaucoma we need to discuss is severe eye pain. This can indicate a type of glaucoma known as acute angle closure glaucoma, which is a medical emergency.
That sounds urgent. What exactly causes this severe eye pain?
Acute angle closure glaucoma occurs when the drainage angle in the eye, which is responsible for fluid outflow, suddenly becomes blocked. This blockage causes a rapid increase in intraocular pressure, leading to intense pain. The pain is often accompanied by nausea and sometimes even vomiting, which makes it different from other types of eye pain.
How quickly does this condition develop?
It can develop very quickly, sometimes in a matter of hours. The symptoms are usually very dramatic and impossible to ignore. Patients often describe it as one of the worst pains they've ever felt, and it's typically accompanied by some vision disturbances like blurry vision or seeing halos around lights.
Is there a real-life example to help understand the severity?
Sure, imagine someone enjoying their evening at home when suddenly they experience a sharp pain in their eye, unlike anything they've felt before, followed by blurring of vision and perhaps seeing colored rings around lights. The pain and accompanying symptoms are so severe that they feel nauseated and might even throw up. It's an alarming experience that sends most people straight to the emergency room.
What should someone do if they suspect they have this type of glaucoma?
If you or someone else experiences these symptoms, it's critical to seek immediate medical attention. Acute angle closure glaucoma is treated as a medical emergency. Treatment usually involves medications to lower the eye pressure quickly and a procedure called laser peripheral iridotomy, which creates a small opening in the iris to help fluid flow and relieve pressure.
It's a relief to know that there are effective treatments available. How effective are these treatments?
They can be very effective, especially if the condition is caught early. The key is rapid response, both by the patient in seeking treatment and by the healthcare provider in administering it. Successfully reducing the eye pressure quickly can prevent permanent vision loss and alleviate the severe pain.
Understanding this makes it clear why recognizing the signs and acting quickly is crucial. Thanks for explaining it so thoroughly, Dr. Mike.
You're welcome, Sarah. It's important to be aware of these symptoms so you can act fast to prevent serious outcomes. Always remember, with conditions like glaucoma, time is often sight. Another sign that shouldn't be overlooked when considering glaucoma is seeing halos around lights. This symptom can be an indicator of glaucoma-related changes in the eye.
Halos around lights? What does that look like?
Halos are bright circles that appear to surround a light source, like a street lamp or headlights. People often notice them in low-light conditions or at night. It's like seeing a glow or a ring around lights, which can make night driving particularly challenging.
What causes these halos to appear?
In the context of glaucoma, halos are usually caused by increased eye pressure that leads to corneal swelling or changes in the lens of the eye. This swelling distorts the incoming light, creating the halo effect. It's a bit like looking through a foggy window. The view isn't clear, and lights can appear blurred or haloed.
Can you give an example of how this might affect someone's daily life?
Certainly. Imagine someone driving home in the evening. As they look at the streetlights and the headlights from oncoming traffic, they see large rings around each light, which makes it hard to see the road clearly. This can be disorienting and might even deter someone from driving at night altogether due to difficulty in seeing properly.
That sounds quite dangerous. What should someone do if they start noticing halos around lights?
If someone starts experiencing halos around lights, especially if it's a new symptom, they should see an eye care professional for a thorough examination. As with other glaucoma symptoms, the goal is to assess whether the eye pressure is elevated and if it's causing these visual disturbances.
What are the treatment options if it's related to glaucoma?
Treatment would initially focus on reducing the eye pressure. This could involve the use of eye drops, oral medications, or in some cases, laser treatment or surgery, depending on the severity and the underlying cause of the increased pressure. Successfully managing the pressure can reduce the corneal swelling or other changes causing the halos.
It's good to know that these symptoms can be managed with treatment. It sounds like keeping up with regular eye exams is key.
Absolutely, Sarah. Regular eye exams play a crucial role in catching these changes early and managing them effectively before they progress to more serious vision problems. Being proactive about eye health can make a big difference in outcomes, especially for conditions like glaucoma. The last warning sign of glaucoma we'll discuss today is blurred vision. This can be a sign of advanced glaucoma, where significant optic nerve damage has already occurred.
Blurred vision seems pretty common. How can someone tell if it's due to glaucoma or something less serious?
That's a good point, Sarah. Blurred vision can result from many different causes, including simple refractive errors like nearsightedness or farsightedness. In glaucoma, blurred vision is often accompanied by other symptoms like those we've discussed: increased eye pressure, peripheral vision loss, or eye pain. If the blurring is due to glaucoma, it usually doesn't improve with blinking or using over-the-counter eye drops.
What happens in the eye to cause this blurring?
In glaucoma, the damage to the optic nerve, which is the critical cable sending visual information to the brain, impairs the eye's ability to process images correctly. This nerve damage distorts the visual signals, leading to parts of the visual field dropping out or becoming blurred. It's like watching a TV with some of its pixels failing. You get an incomplete and unclear picture.
Can you share an example of how this might manifest in everyday life?
Sure, imagine someone who enjoys reading. As glaucoma progresses, they might find that the text starts to blur, and no matter how much they adjust the book's distance or change their glasses, they can't get the words into clear focus. It might also become harder to recognize faces or navigate new environments.
That must be quite frustrating. What are the treatment options if the blurred vision is due to glaucoma?
By the time blurred vision occurs, the focus is on preventing further vision loss rather than restoring the vision that has been lost, as glaucoma damage is unfortunately permanent. Treatment options like medications, laser therapy, or surgery can be used to manage eye pressure and minimize further damage.
It's sobering to think about how serious glaucoma can be. What's the best way to prevent it from getting to that point?
The best strategy is early detection and consistent treatment. This is why regular eye exams are so crucial. They allow eye care professionals to detect subtle changes and begin treatment before significant damage occurs. It's also important for individuals to be aware of their family history, as glaucoma can be hereditary. Awareness and proactive management are key.
Thank you for all the valuable information, Dr. Mike. This discussion has really highlighted the importance of not ignoring these warning signs and keeping up with eye health.
You're very welcome, Sarah. I'm glad to hear you found the information helpful. Remember, taking care of your eyes is a vital part of overall health. If you ever notice any changes in your vision or experience any of the symptoms we discussed, don't hesitate to consult with an eye care professional. Stay vigilant and stay healthy.
I will, Dr. Mike. Thanks again for your guidance.